Hi, my name is Jessica Guglielmo, and welcome to my presentation on signs your patient is declining. First, let's go over what this presentation is about and what it's not about. This presentation is an overview of the most common signs and symptoms that might indicate your patient is declining, or that you might need to call a rapid response or code. What this presentation isn't about is it's not a comprehensive list of signs and symptoms indicating deterioration or a need for a rapid response or code. It is also not a replacement for a full assessment or your own nursing intuition. So what is patient deterioration? Patient deterioration is an evolving, predictable, and symptomatic process of worsening physiology towards critical illness. Some of the easiest signs to recognize that a patient is declining can be found by looking at their vital signs. This can be their body temp. If you've got a patient that has a body temperature that's below 36 degrees Celsius or above 38 degrees Celsius, this could be a sign that your patient might decline. Similarly, things like heart rate, a heart rate below 60 or above 100, a respiratory rate that's below 15 or above 20, and also a blood pressure, the systolic blood pressure, if that's below 90 or above 180. These can all be signs that your patient is declining or will be declining shortly. Pay attention to these signs. Some other assessments that might indicate your patient is declining include acute pain, especially acute pain that is in the abdomen. Acute pain in the abdomen can indicate an infection, perforated ulcer, or intestinal obstruction. However, acute pain in any part of the body should be taken seriously, and you should try to investigate why that patient is experiencing that acute pain. A change in mental status is especially important to note. This can include delirium, confusion, or acute changes to their personality, their level of alertness, or their memory. Also, pay attention if a patient states they feel like something is wrong. It should be taken very seriously and investigated, as patients can often have an early sense that they are declining. What if something doesn't look right? If you or a family member notice something just doesn't seem right, doesn't look right, this should also be taken seriously, especially if it's noted by someone who knows the patient well. Shortness of breath can be a critical sign that something more serious is occurring, such as a heart attack, infection, pneumonia, or pulmonary embolism. Changes in urine output or appearance can be a cause for concern that can indicate organ function, an infection, or potential other serious conditions. Finally, another assessment is what if the patient is pale? If a patient is very pale, especially if they are breaking out in a cold sweat, this can indicate complications such as shock, bleeding, heart attack, or infection. Another key assessment piece, if you're trying to determine if your patient is declining or might decline soon, are lab values. Some important lab values, and these are only a few, are the following. You should look at their creatinine and BUN. This can indicate a decreased kidney function. Their hemoglobin and hematocrit, this could indicate anemia. Maybe they're bleeding out somewhere. Lactate, increased severity of disease, often high lactate might say that that patient is going septic. A troponin or BNP shows maybe if something critical is happening with the heart, like a heart attack or heart injury or heart failure. HCO3, pH, PaCO2, these are all indications of acid-base balances within the body and can indicate if there's a respiratory or metabolic failure occurring. Glucose, blood sugar levels that are low can be critical, but also note ones that are incredibly high. This can also be a precursor to a declining patient. Platelets, a patient that has low platelets can be at a risk for bleeding and can show bleeding disorders. WBCs, your white blood cell count. A high white blood cell count can be a sign of infection. Now that you know some signs and symptoms that indicate your patient might be declining, what about rapid responses? When should you call a rapid response? A lot of the signs and symptoms of calling a rapid response are similar to that of a deteriorating patient, except sometimes they're more severe. That being said, always feel comfortable to call a rapid response with or without the following signs we're about to go over. Some signs that might want to prompt you to call a rapid response team is heart rate over 140 or below 40, a systolic blood pressure that's over 180 or below 90, a respiratory rate that's over 28 or below 8, and an SpO2 that's less than 90%, despite you providing oxygen supplementation, deep breathing, and other such respiratory interventions. Next, when would you call a code blue versus a rapid response team? What's the symptoms and signs to call a code blue? These are also more severe than what you would find for a rapid response. So signs to call a code blue, they're your patient stopped breathing. They don't have a pulse. You're not sure if they're breathing or if they have a pulse. Or you're the nurse and you're not sure what to do and you're very concerned for the life of the patient. Okay, that's it for now. It's a short list of some of the more common signs and symptoms that your patient is deteriorating. You might need to call a rapid response team or you might need to call a code blue. Again, always call a rapid response team and or a code blue if you feel like it's indicated or you are unsure what to do. And if you have any other questions, here is my email and my phone number. Please feel free to reach out to me at any time. Thank you.